We're coming up with lots of different use cases within the health space. The one that I wanted to share today is on the benefits admin side. So there is a settlement claim that's paid out, and that money can only be used for medical expenses. Those typically are sent to a third-party administrator to be able to pay the medical bills. Because if you give it to the individual, then the individual could use that money for whatever they want. So it goes to a third-party administrator. And there's a bunch of these out there. One of these sent out an RFP. Managing hundreds of millions of dollars in escrow deposits, has very specific specifications. But one of the most interesting specifications that they came up with is they wanted to be able to manage the whole thing headless, meaning they never wanted to sign on to the user interface. What's interesting with this is as an API-based system, we actually don't care how we get the instructions on what to do with the escrow deposits. It could be through the user interface. It could be through bulk actions via file uploads, or it could be through an API. And this particular company had their own software system. We ensured that all of the data that we needed was in that software system. We connected directly up to their API, and we've been able to help them fulfill. One of our banks with the ZEscrow platform was able to help them fulfill those very, very specific requirements. So again, it's not an exhaustive list of different stories, but I hope that you can get this idea that these three-party accounts, or in some cases where you just have a pool of funds that need to be split up amongst others, are a very lucrative place to be able to drive deposits. And with the ZEscrow platform, you're able to differentiate the offering that you provide, because it's going to be more efficient and going to be able to take a lot of the manual processes that are currently required to support these types of accounts away.